Hello everyone, this is Shaika Poudel Dhakal. Today I'm going to present a case study on safe medication administration. Before going to the medication, I want to give short introduction to my patient. My patient is Edward Axis, 85 years old male. He is admitted in the rehabilitation ward after having a fall. His medical history includes arterial fibrillation, permanent pacemaker, hypertension, hypercholesterolemia, arthritis, and GORD. He is also allergic to the fish and aspirin. We can see his observation on this slide. Moving into the next slide, among the medication of Edward, I have chosen simvastatin. Simvastatin is mainly used to control or reduce the amount of cholesterol in our body. It is also used to treat stroke and other coronary diseases. Adverse effect of simvastatin includes joint pain, headache, dizziness, muscle pain, and others, as you can see on this slide. Talking about the usual dose is 5 to 40 mg per oral. It is usually given at night time because many research suggests that the most cholesterol is synthesized when dairy intake is at its lowest. It also depends on how severe the condition is. Talking about the contraindication of simvastatin, it is contraindicated in pregnancy and breastfeeding because various research suggests that statin are known to inhibit biosynthetic process for normal fetal development, and it may also disrupt infant lipid metabolism. Talking about the nursing consideration, as a nurse we should always monitor patient cholesterol and lipid profile to evaluate the effectiveness of the treatment. Liver function tests should be performed to obtain baseline measurement, as statin can increase in the level of enzymes that signals liver inflammation. Talking about the interactions with other medication, simvastatin mostly interacts with anticoagulant, dioxin, erythromycin, and antifungal medication. When simvastatin is given with anticoagulant, it can increase IMR rate. An increase in IMR means the blood clots more slowly than the recommended time. Simvastatin and dioxin interacts with each other as well. Dioxin can increase the amount of cholesterol medicine in the blood and can cause muscles problem. Similarly, some lipid regulating agents like simvastatin may increase the amount of dioxin in the blood. Other medications like erythromycin, verapamil, and antifungal may cause rhabdomyolysis. Grapefruit is not recommended to the patient using simvastatin because it contains a chemical that interferes with body's ability to break down uh, statin medication. So this can increase the possibility of side effect. In this case of Edward is using anticoagulant, which is rivaroxaban. So close monitoring of INR should be done. As Edward is also using dioxin, any tenderness, muscles weakness should be assessed and reported to the doctor. Blood cholesterol and dioxin levels should also be closely monitored. Moving on to the next slide, a nurse should always consider trend rights of medication administration to ensure the safety of the patient by reducing medication error. In this case of Edward, I will always check identification band of Edward against the medication chart and observation chart. I would also ask him about his date of birth and name verbally. To ensure the right medication, I will double check the medication in the stock with medication required. Right dose should be given to the patient. Simvastatin is available in various doses, but it will requires 20 mg. So proper medication calculations should be done. I would always check right dose, right time, and right route. It was has a right to refusal. I would respect its choice by providing education. I would always educate him on negative impact of not having medications as well. As a nurse, we have to make sure that Edward has the overall idea of his medication and why he is taking them. Side effect of the medication should be explained. In Edward case, the side effect is dizziness and the muscle pain. So we need to educate him not to get off from the bed after having the medication to reduce the risk of fall. We should always ask him to call the nurses or the care staff if he require any assistance. Cholesterol test cannot be done every time after giving the medication in order to evaluate the effectiveness of the medication because it takes about 6 weeks for the statin to stabilized. So cholesterol test can be done after 8 weeks of the statin therapy to evaluate the outcome, but assessment can be done by asking Edward if he is experiencing any of the given symptoms. Moving on to the next slide, I have listed the ways to minimize the risk of medication errors in the hospital setting. I have mentioned earlier 10 rights of the medication administration should be followed. Various research suggests that medication errors occur when the nurse or the medicator is disturbed. So disruption should be minimized as much as possible. This can be done by putting the t-shirt of do not disturb sign or the quiet zone sign. Drug guides should also be available at all times to make sure nurse is familiar with indication, contraindication, side effect of the given medication. Nurse should always know the formula for the drug calculation to minimize the error, or else they can end up giving overdose or underdose of medication to the patient, and this can cause serious problem. Patient education is most important factor to be considered. Side effect of simvastatin should be explained. We should always educate Edward to report any signs of muscle pain and dizziness as well as other sides of the medication. Close observation of Edward should be done to assess any of the symptoms. We should always educate Edward not to take grey food as it interferes with absorption of the medication. Again, to ensure safe medication at home, Edwards should be educated on how to take medication at home, what are its side effects, what can be done if he experiences side effect, what are the time to take the medication, how does medications look like. Edwards should also be educated about the diet. Edwards should be suggested to take a low carbohydrate and low fat diet as he has got hypercholesterol level, hypertension and arterial fibrillation. To empower and engage Edward for safe medication, we should always educate Edward about the prescribed medication, provide Edward a current list of all the medication he is taking with the dose and the frequency, explain Edward how he can refill the medication, how to pay for the medication, and if the medication is covered by the health insurance or the Medicare card. Also explain him about the social service if he is having any problem for purchasing the medication. Edward is in his 80s and he mentioned that it is hard for him to stay on track on the top of the everything. He might not adhere to the medication because of the physical inabilities. Sorry. So we should always educate him to keep the medication in the bedside table. For example, simvastatin is taken at night time usually. Edward might not take the medicine if it is in the other room or out of the reach. But if his medication are near to him, there is more chance of him taking the medicine. To assist Edward for the safe medication management, number of intervention can be done. To ensure Edward is taking the medication in the right time, uh, Edward is medication calendar or chart or electronic reminders should be given. A telephone reminder can also help. Close monitoring should be done. We should always follow up how Edward is going with his medication, if he is having any problem with refilling or remembering to take the medication, and if he requires any assistance as they are living alone independently at home, and if they are having any problem, if they are experiencing any problem, we should solve it with the help of other team members. These are my references for the case study presentation. If you have any questions, please do ask in the comment section and in the discussion board, as I will also be posting in the discussion board. Thank you.